Welcome to the pathology class. We are continuing with the chapter of inflammation and healing. So we have completed acute inflammation. Now we are going to start with chronic inflammation. So we have dealt with acute inflammation from the part 1 to part 5. So part 6 onwards we are going to deal with chronic inflammation. So in chronic inflammation, in this session we are going to understand the definition, causes, general features and types of chronic inflammation. Then we are going to explain about giant cell, where we are trying to know about types with examples, and we are going to deal with last part of chronic inflammation, that is granuloma, its definition, pathogenesis and description. So moving with the chronic inflammation, as name itself suggests, it is a chronic type of inflammation where, as we have dealt in our first class of inflammation and healing, it is a prolonged process of inflammation. So definition goes as, chronic inflammation is defined as a prolonged process in which tissue destruction and inflammation occur at the same time. So here we see both the processes occurring at a same time. That is, one is the tissue destruction is going on, as well as we can see the inflammatory changes also found at that particular point. So both together occurs in chronic inflammation. Causes, as per the causes are concerned, we, we have divided into three causes of chronic inflammation, which are chronic inflammation followed acute inflammation. So at last class we have seen that how exactly the outcome of the acute inflammation is there. So the chronic inflammation followed with acute inflammation. So here, so acute inflammation, if the stimulus or the what we call as the cause is not removed, then it will end up into chronic inflammation. When the tissue destruction extensive or the bacteria survives and persists in small number at the site of acute inflammation, that particular inflammation will continue as a chronic inflammation. Right? For example, in osteomyelitis, pneumonia terminating in lung abscesses. Second cause, recurrent attacks of acute inflammation. So here recurrently one particular acute inflammation is occurring repeatedly, right? So in that condition we can say that the particular acute inflammation is going to land up in chronic inflammation. So when repeated bouts of acute inflammation culminate in chronicity of the process. For example, recurrent urinary tract infection, which leads to chronic pyelonephritis. So a person is having recurrent attacks of urinary tract infection. So because of that, it will land up into chronic pyelonephritis. So that is a chronic inflammation. Last cause, that is chronic inflammation starting de novo. So from the beginning itself, the inflammation is chronic in nature. Right? So when the infection with organism of low pathogenicity is chronic from the beginning. For example, in case of Mycobacterium tuberculosis. So condition is tuberculosis, which causes the tuberculosis. Tuberculosis is from the beginning itself, it is a chronic in nature. So we see the tissue destruction as well as the inflammation at from the beginning itself. Going further for the general features of chronic inflammations. So there are differences in chronic inflammatory responses depending upon the tissue involved. So here you can see different types of responses depend upon the tissue which is involved in chronic inflammation and the causative organism. So here two things, one is tissue and second is causative organism. It defines about the occurrence of chronic inflammation. there are some basic similarity among various types of chronic inflammation. So as we say, we can see different responses depend upon the tissue involvement as well as the causative organism. But in chronic inflammation, some of the features which is common for all the chronic inflammation, right, are there. So those we are going to see here. So these are three common similarities, which is basic similarities found in chronic inflammation. One is mononuclear cell infiltration, second tissue destruction or necrosis, and third one proliferative changes. Okay, so we deal one by one. First is mononuclear cell infiltration. So what it means? So in chronic inflammation lesions, we see infiltration by mononuclear inflammatory cells like phagocytes and lymphoid cells. So the site of chronic inflammation, we can see these particular cells are present. Right? Those are phagocytes and lymphoid cells. So phagocytes are represented by circulatory monocytes. So here the monocytes are collected. Those are known as phagocytes there. So tissue macrophages, epithelioid cells, and sometimes multinucleated giant cells are present. So these are the common features we find in chronic inflammation. The macrophages comprise the most important cells in chronic inflammation. So macrophages are the most common things we can see in chronic inflammation. Right? As in case of acute inflammation, we see common is inflammatory cells. Those are PMNS, right? Polymorph nuclear cells, right? Same way, here we see macrophages are very commonly seen in chronic inflammation. These are appeared at the site of chronic inflammation from one, that is chemotactic factor and adhesion molecules for continued infiltration of macrophages. Second, by local proliferation of macrophages, and last, third one, that is longer survival of the macrophages at the site of inflammation. Moving to the next common feature, that is tissue destruction or necrosis. Right? So the tissue destruction and necrosis are central features of the most form of the chronic lesions. So this necrosis and central tissue destruction we don't find in any of the other inflammatory region. Like acute inflammation, we can't find it. So this is very commonly present in case of chronic inflammation. So this is brought about by activation of macrophages, which is released with varieties of biological active substances. Some examples we have quoted: protease, elastase, cholinesterase, lipase, and reactive oxygen radicals. Even the cytokinin, nitric oxide, angiogenesis, growth factors, etc. So these are some of the factors, some of the biological active substances because of which the macrophages are activated at that particular site and forms the necrosis. Lastly, the general features, which are proliferative changes. Some of the proliferative changes we can find in chronic inflammation. What are those? As a result of necrosis, proliferation of small blood vessels and fibroblast is stimulated, resulting in formation of inflammatory granulation tissue. So here there is a proliferation of small blood vessels and fibroblast takes place at that particular site of chronic inflammation. So we see the formation of inflammatory granulation tissue. So eventually healing by fibrosis and collagen lying takes place. Okay, so here at that particular site of inflammation, we can see the healing of by fibrosis and formation of collagen link, which takes place at that particular site. So here proliferation of fibroblasts and small blood vessels takes place at the necrosed part of the chronic inflammation. Okay, these are the few general features which is common at all the chronic inflammations. Okay. Moving further with the types of the chronic inflammation. So broadly, we have classified chronic inflammation in two types. One is non-specific chronic inflammation. Second is specific chronic inflammation. Right. So some books have given like that, and some books are noted, which I have quoted here, like classification as chronic non-specific inflammation, specific, that is chronic granulomatous inflammation. Right? What are those? Chronic non-specific inflammation is characterized by non-specific inflammatory cells infiltration. So they are not specific one. So the specificity is not there. Right? For example, in case of osteomyelitis, lung abscess, right? A variant of this type of chronic inflammatory response is chronic suppurative inflammation, in which infiltration by polymorphs and abscess formation are additional features like actinomyces. So here we see a combination of plenty of things going on in chronic non-specific inflammation. Secondly, which is very specific one, which is also known as chronic granulomatous inflammation. So here it is characterized by formation of a granuloma, right? So a granuloma is formed. Further, when we are dealing with the chapter, we know we're going to describe about granuloma. So some examples for chronic granulomatous inflammations are tuberculosis, leprosy, syphilis, actinomycosis, and sarcoidosis. Okay, these are the types. Now, next, as per this syllabus, we should know what are germ cells, right? So, which is a contributing factors in chronic inflammation. So, germ cells, also called as Langerhans germ cells, large cells characterized by an arc of nuclei towards the outer membrane. So these are the larger size of cells, which is having an arc of nuclei towards the outer membrane. The cells is formed by the fusion of epithelioid cells, which are derived from immune cells called as macrophages. Okay. Once fused, these cells share the same cytoplasm and their nuclei. So they share the cytoplasm as well as nuclei. So same, at the same cytoplasm they are sharing. Okay, so becomes arranged in an arc near the outer edge of the cell. Okay, fine. Moving further, so some of the types of germ cells are there, which are specific. Like one is germ cells in inflammation and germ cells in tumors. So here we are concerned more about the germ cells in inflammation, because our chapter is inflammation. So these are foreign body germ cells, Langerhans germ cells, Toton germ cells, and Scott's germ cells. Okay, so this is a little more descriptive for understanding of it. Okay, so as per your syllabus, only you should know the definition of germ cells. Okay, fine. Moving further, for our chapter, next part is granuloma. Okay, what is granuloma? What do you mean by granuloma? So definition goes as granuloma is defined as a circumscribed tiny lesion about 1 mm in diameter, composed predominantly of collection of modified macrophages called epithelioid cells and rimmed at the periphery by lymphoid cells. So this is a combination of all the components, right? One is macrophages, epithelioid cells, and also the lymphoid cells. This is called as a granuloma. The name granuloma is derived from the granule, means circumscribed granule like lesion, and oma means is a suffix commonly used for a true tumor, but here it is indicate a localized inflammatory mass. So a mass itself is known as oma here, or collection of macrophages. So what is the pathogenesis of granuloma? How exactly the granuloma is formed? The formation of granuloma is a type 4 granulomatous hypersensitivity reactions. Right? So it is a type of hypersensitivity reaction. So it is a protective defense reaction by the host, but eventually causes a tissue destruction because of persistence of the poorly digested digestible antigen. Example, Mycobacterium tuberculosis, leprae, suture material, particles of a talc, and etc. So, sorry, mainly this is a protective or defense reaction, but here because of tissue destruction takes place, so it is one of the form or one of the factor, a contributing factor in a chronic inflammation. So what are the sequences takes place in the formation of granuloma? One is engulfment by the macrophages. So here a process of phagocytosis takes place where the macrocytes engulf the antigen and try to destroy it. But since antigens is poorly degradable, these cells fail to digest the antigen, right? And instead undergo morphological changes to epithelioid cells, right? Number one. Second, the CD4 plus T cells, those are macrophages, being antigen present cells, having the failed to deal with the antigen again, right, which is present in the CD4 plus T lymphocytes. So these lymphocytes get activated and elaborate the lymphokinase, right? Okay. Then thirdly, the action of cytokines comes here. So various cytokines, as you know, what is cytokine? It is a inflammatory mediator, chemical mediator. Okay, so these various cytokines formed by activated CD4 T plus cells and also by the activated macrophages perform the following roles. What are the roles they perform? One is IL-1 and IL-2 stimulates which proliferation of more T cells takes place. Secondly, interferon Y activates macrophages. And third one, TNF alpha promotes fibroblast proliferation and activates endothelium to secrete prostaglandins, which have role in vascular response in inflammation. And lastly, the growth factor, right, which plays a major role here, which elaborated by the activated macrophages, which stimulate fibroblast growth. Right. So these are the sequences takes place in formation. Then finally, the granuloma is form of macrophages modified as epithelioid cells. So they are modified forms of epithelioid cells in the center with some interface multinucleate genesis surrounded peripherally by the lymphocytes and mainly which are T cells, and healing by fibroblasts or collagen depend upon the age of the granuloma. So as the age progresses, there are changes. Again, we find some changes in the process of granuloma. Fine. So this is in short a picture elaborative of how exactly the granuloma is formed. First, the cell injury, cell destruction takes place, inflammatory reaction which the cell destruction takes place. There is a failure to digest the agent, then goes for the weak acute inflammatory response. So here we are not able to digest, we are not able to engulf by the macrophages, try to fight, not possible, then go for the virulence by infectious agent where there is a T-cell modified immune response curve and there is a poor digestive agents also take, which because of that there is activation of CD4 T cells takes place, right, where they release so many types of lymphokinase, right, and monochemotactic factors. Because of that, there is accumulation of tissue macrophages takes place, right, where there is a increased recruitment from the circulation and local proliferation takes place of T cells. In turn, going for macrophages activation by IFNN. Okay, then which gives rise to one is transformation to epithelioid cells and germ cells. Then secondly, it goes for secretion of fib fibroblastic proliferating cytokinin, that is TGFP and PTGF, and this combine form the granuloma. It commonly form the granuloma. Hope you understood the process of formation of. So next, moving to the what are the composition of granuloma? What exactly a granuloma is consist of. First, in generally, they are having following. These are the composition of granuloma. One is epithelioid cells. Here we can find. Next, we are having multinucleated giant cells. This we can have here, giant cells. Then we have lymphoid cells, also known as lymphocytes. These are the lymphocytes. Here we can have lymphocytes. Then we have necrosis. We have a tissue of necrosis. Then we have fibrosis by fibroblasts. These are the fibroblasts. So this altogether a composition of granuloma. This is what granuloma is, and this is the processes which we already discussed how exactly it takes place to the formation of granuloma. This is all about chronic inflammation. So here we are concluding with part 6 of chapter inflammation and healing. So here we are also concluding with a part of first part, that is the inflammation, where we have dealt with from the beginning. We have dealt with inflammation, its definition and types, then what are the causes, then we have dealt with acute inflammation, where we have gone with vascular event, cellular event, then we have understood the concept of chemical mediators further on. Then today we have finished with chronic inflammation. Okay, so next class we are going to start with healing part of inflammation and healing chapter, right? So here next class we are going to deal with the healing part. So hope you have understood the concept and the pathology behind inflammation. Any query, again I will repeat, if you have any query regarding this chapter, please feel free to ask either in the Google Classroom, or you can post your question personally on my WhatsApp or a group which we are having, right? Thank you.